So everything Ken said about Canada applies to the US. We have some special things going on here, but what happened is the same. It's the same history. So the one difference, and maybe Canada has this, but the US passed in 1978 ICWA, the Indian Child Welfare Act. And ICWA says that departments of child welfare must make active efforts to preserve the family, and not remove the child and instantly put them into foster care. How well that has worked out, we're about to see. Oh dear. Okay. So I'm just going to briefly refer to this website. If there were time, I would show you 1 minute of a 5-minute clip that comes from NICWA. NICWA is National Indian Child Welfare Association, and they do good research. They put on a conference every year, and they were very active in helping make sure that ICWA is actually implemented. It can be on the books, but if nobody actually is following it, that wouldn't do any good. So 1978, you would think all this would have ended. No, children were still being removed at higher levels than children of other ethnic groups. Boarding schools had ended by that time, but the legacy of boarding schools had lived on. So what happened? What is this legacy? The legacy is intergenerational trauma. So if a child was removed back in the 1940s, forced to go to boarding school and lose all their family ties, they weren't nurtured by a mother and father. And some of the people who chose to work at boarding schools were actually pedophiles. And that's probably why they applied for that job. And they all got hired. And it's been a terrible legacy of sexual abuse on the part of boarding schools and even foster homes, which we wouldn't want to happen, but it does happen. So research has shown that Native children adopted away from their families end up with all these terrible mental health consequences: drug abuse, alcohol, suicide, trauma. And the research also shows that if a child is involved in their own community and in traditional cultural activities, they have better mental health. So this is from Time magazine. And then when I researched this, I found that my collaborator and co-author, Dr. Nancy Lucero, was actually quoted in this article. She hadn't told me. She's very modest. But she's a member of the Mississippi Choctaw Nation, and that's how I got involved in the research. I'm a white person, but I got involved, and she and I have collaborated for close to 20 years. But she has heard judges say, well, why not just let the children grow up in a good, well-off white home, and then when they're adults, they can go back and rejoin their tribe. On one level, that might sound, well, okay, but it turns out it's not that simple. You don't just rejoin your tribe. As she puts it, cultural connection is developmental. You develop your connection to who you are and who your people are over time. You don't just at age 18 or 21 say, I'm back. What do I need to, what have I missed? So Nancy, like me, worked in mental health as a clinical social worker for many years before becoming a researcher and academic. So the reason we wrote the paper that is currently about to be published in child welfare is that we both saw that while the center in Denver we were working at, she was clinical director and I was the program evaluator as a consultant, we saw that there was a lot of trauma in the young parents, young mothers of 19, as Ken was talking about, 27, a whole lot of bad things that happen in their life, and poverty is a form of trauma. We've kind of done some research on that, but there are other traumas as well, especially assault, and especially dangerous being women. So here's what our paper looks like. We got a preprint from Child Welfare Journal, and we are summing up that there are very high levels. We found high levels of trauma in the parents who took the survey, and we believe that departments of child welfare must address this trauma as part of keeping the family together. Because if you offer parents various services, but you don't treat their underlying trauma, you act as though it just doesn't exist, like, well, just snap your fingers and get it together and everything will be fine. It won't, because trauma is long lasting. Not everybody is traumatized, maybe, and it doesn't always look like PTSD. It often looks like depression, anxiety, and sometimes substance abuse, where someone is trying to self-medicate their own depression. So ICWA says you must make active efforts. Well, what's active? At a minimum, you need to contact the tribe. And most tribes now have an ICWA specialist. So you need to contact that person and say, hi, we have a child. The parents are in trouble here in Denver, Colorado. What resources does the tribe have? Do you have any tribal foster families? Different things like that. The main goal is to provide services that maintain and reunite Indian children. So another example would be recruiting foster families who are American Indian. And Denver has a fairly large American Indian population because a lot of men were moved here in the 1950s through a program called relocation. They were given a bus ticket to Denver and $50 and an inroad on a job. And it was a deliberate effort, actually, to break up reservations, break up and assimilate American Indians out of their own community into a large urban area. One other example would be if you give somebody who's very poor and very depressed a card with a referral on it, say, here, go call this number and get an appointment, say for substance abuse services, they may not make it. I mean, life is hard. So active efforts would be that you would actually either give them a bus token, or if really the bus doesn't go where that treatment center is, drive them there. Get them an Uber coupon, pick them up, whatever it takes. That would be an active effort. So disproportionality remains. At the national level, right now, today, American Indian children are more than twice as likely to be removed as their percent in the US population, and Black children very close to twice as likely. White, Asian American, and Hispanic Latino children are less likely to be removed than their proportions in the population. There are many ways to measure disproportionality, but this one's pretty intuitive and simple. You just say, here's how many there are in the population, here's how many there are in child welfare. So people are wondering, what are the causes? Are these families more trouble? Do they hurt their children more? Is it poverty? Is it larger families? Is it substance abuse? And there's been research done on all of this. And yes, there's a strong tie between poverty and neglect. The largest reason children are removed from American Indian families, as Ken said, is neglect. It's not abuse. It's not, there's very little violence, but it is neglect. And the children may really be suffering, so they need help, they need resources. But why are the children removed? You know how expensive foster care is. Why wouldn't we just give those same amount of resources to the family and say, here, family, you need help, we're gonna help you out. There's kind of not the political will to do that. I'd like to see it. But it's very clear that there is either unconscious or overt bias. The other factor that led us to do our study using something called the Trauma History Questionnaire, which has 28 traumas listed and asked people, did you suffer this? Is that in the national literature, there are very high levels. So we wanted to know what are the levels of the parents being seen here. And these numbers, I'll give you the national figures for each one, and you'll see it's much higher. So serious accident, I could find figures on car accidents. I couldn't find, industrial accidents. But on the national level, 3% of people have been in a serious car accident. This is 61%. This is huge. At the national level, about 18% of people have been raped or sexually assaulted. In the American Indian community, the number is close to 50%, 49. Stalking, at the national level, 16% of people report being stalked, and here 28%. And finally, and maybe the most astounding one, kidnapping. How often do you hear about a person being kidnapped? At the national level, 1 in 300,000 is kidnapped. That's so tiny, it doesn't make a good percentage. Here, 22% of the women report being kidnapped. Almost all of them, so all parents but one, that turned out to be 98%, had experienced at least one and often 4 to 6 of the 28 traumas. So to conclude, we've assessed trauma. We know it's there. Now it's time to offer treatment. So you'll hear about child welfare has become more and more trauma informed, and you'll see articles about trauma informed child welfare. Mostly that means offering trauma treatment to the children, and the children definitely need it, and so there's some good therapies like trauma focused CBT. But there's very little being done for the parents because they're seen kind of as the perpetrators. But they may have grown up traumatized, so they need help too. Therapy is far less expensive than foster care. It costs a little more than a class, but it's worth it. And we believe that offering therapy is an active effort, and it meets what ICWA is asking child welfare to do. So this is the topic of our next paper. We're doing a systematic review of trauma treatments that have been validated for American Indian populations. The literature is tiny, but we're out there looking for it. And that concludes my talk.
Thank you so much, Marian. I think it's fascinating, and I think your contribution to the literature and the research is so significant, and it builds on the presentation that Ken did in terms of the lived experience.
Stop sharing.
So I think that really gives a really good perspective on the work.